everybody. Are you also preparing for AIIMS and foreign licensure examination? तो clinical based questions. Yes. आज हम डिस्कस करने वाले हैं regarding the case based questions, the case scenarios that could be asked to you. Yes. ये कुछ ऐसे प्रश्न है. These are few of the questions that you will be facing in your upcoming examinations for AIIMS और अगर आप foreign licensure की तैयारी कर रहे हैं तो सर टेल अस अबाउट दीज क्वेश्चंस. एग्जैक्टली ये क्वेश्चंस है क्या? सो सबसे पहला, हाउ डू यू सॉल्व देम? सो टुडे आई विल बी टेलिंग यू अ स्टेप बाय स्टेप गाइड, a complete 360 degree plan. Whenever a case based questions comes to you, what all things do you consider? Number 1, condition of the patient. Comorbid hai, hypertension, diabetes, asthma. Patient history, family history as well as medication history dono, whether in the family anybody had cancer, diabetes. Patient history, if the patient is having any other nutraceutical, pharmaceutical or any other supplement with it. Third, so these are the two most primary conditions, history. Then another point that you should consider: age, weight, sex, female or male, pediatric, geriatric, any special population like the lactating women, pregnant women, whether there is renal or liver impairment, because most of the drugs are metabolized and excreted from the body through the renal route and through the hepatic system. So if the hepatic system is not functioning well, that means you could suffer from any excessive dose toxicity, because the drug will precipitate, it will not be eliminated from the body. So you need to taper down the dose. Aapko dose kam karna padega. You taper the dose, right? So this is a planner, and the 4 most important points that you should consider. Then you should check the diagnostics, radiological or any other reports, laboratory reports like kidney function, liver function, thyroid function, hematological, lipid profile, cardiac function, anything. So radiological, X-ray, CT scan, MRI, USG, or any other endoscopy, any other results, correct? That you need to check. Then the level or the severity, whether it is stage 1 fatty liver, stage 2 fatty liver, severity. What is the exact cause? Is it acute kidney failure, chronic kidney failure? How much is the GFR, right? The creatinine level. So all of these factors determine your solving strategy. So these are some of the things that we will be discussing in today's class. So stay tuned. Let's move forward. When I say read the case carefully, every case is a special case. So identify the keywords. के major important keywords कौन से? If you identify those keywords, things will become very very easy for you, and there will be an easy pathway for you कि हाँ ये ऐसे ऐसे solve करना है. So solving the questions is very important. Ask if they're asking whether they need a drug which is having rapid onset or a sustained release, right? Because if you want a sustained release, maybe pentoethanol, letranitrate or some other nitrates, extremely rapid onset, then you might need sublingual isosorbide dinitrate. Okay. Similarly, there are so many examples like insulin, rapid acting insulin, lispro, glulicine, aspartate, correct? And if it is you want long acting, so detimivir, glargine, right? All of these agents. Lente, correct? Those are long acting. So which exactly duration you want? The next, identify the special populations. Have they asked questions about the neonates, infants, adults, pediatrics, geriatrics, old age patients? Because the body water content, the total fat content, the metabolism capacity, there's a process called homeostenosis, in which with aging your physiological maintenance or homeostasis power decreases. So all of these things you have to consider, right? Some drugs are also excreted in the milk. So USFDA has given a category A, B, C, D, X. A is safe in pregnancy and breast milk. B is safe in pregnancy but not breast milk. C is a little unsafe in both pregnancy and breast milk. D, big no to breast milk and pregnancy, lactating women, right? E, so forget it. X, you cannot give only in the pregnant lady. Next, identify the which organ system they are talking about: cardiovascular, neurological, nephrological, hepatological, hematological, endocrine, musculoskeletal, gastrointestinal, digestive, pulmonary, renal. Correct? Which system they are exactly talking about? Which disease are they exactly talking about? Angina, arrhythmia, hypertension, lipidemia, DIC, DVT, or are they talking about anemia? Are they talking about kidney failure, kidney stones, nephrolithiasis, ascites? Are they talking about fatty liver, fibrosis, cirrhosis, carcinoma? Are they talking about Alzheimer's, Parkinson, epilepsy, depression, psychosis, mania, bipolar, multiple sclerosis, varicose veins? What exactly condition are they talking about? Identify the system. Are they talking about impetigo, cellulitis, eczema, abscess, SLE? Which condition? Or rheumatoid arthritis, osteoarthritis, gouty arthritis, right? Are they talking about some anesthetic, some drug interactions? You have to identify those, very, very important, because till until unless you don't know anatomy, pathophysiology, and physiology well, things won't function at a good end. All right. So identify whether you're talking about jaundice, whether they're talking about some constipation, diarrhea. Which disease are they exactly talking about? Extract the key clinical cases, like have they mentioned any lifestyle modification, because pharmacological interventions is of course required, but sometimes non-pharmacological interventions are also required. So checking about the non-pharmacological interventions, interpreting the laboratory findings, kidney function test, liver SGPT, SGOT, GGT, stercobilin, urobilin, total iron binding capacity, bilirubin. All these levels must be estimated, conjugated and unconjugated. Bilirubin, then troponin, LDH, CKMB, electrolyte ions, X-ray, CT scan, MRI, USG, CBC. So all of these things must be at the tip of your tongue. Next, identify the diagnosis. So you should know that what is the exact diagnostics that you have taken out from that, and checking out if there's any contraindications involved, if there's any two medications which are not to be given simultaneously, concomitantly. So working upon that कि हाँ भाई ये दो medication को मैं साथ में नहीं दूंगा, right? Concomitant medications which are to be supposed to be avoided. Evaluating the contraindications, first line and second line agents, whether they have asked the drug of choice first line agents or have they asked the second line agents. Like suppose if they're asking preeclampsia, hypertension, a lady is pregnant and she needs a hypertensive drug, which drug could you give? So you should know that in that condition you will give labetalol or aspirin daily, or you can give methyl dopa, which is safe in pregnant women, right? So these are all important criteria that you should understand and take into consideration whenever you're dealing with the whenever you're dealing with the agents. Pharmacokinetics, observing the dose, gram, milligram, ml, liter, like vancomycin. Orally also and via infusion also it's given. But whenever a patient has higher chances of red man syndrome, we infuse it over a period of 1 hour. Correct? So those things are very, very important, considering the body weight. Then some cytochrome interactions. Some are synergistic, some are antagonistic. Some displace the protein, some affect the absorption, distribution, some affect the metabolism via enzyme induction and inhibition, some alter the tubular secretion, pH. So there are different factors that are affecting the different drugs that are given together, like lamivudine, stavudine is avoided, digoxin, thiazide, quinidine is avoided together, warfarin, aspirin is avoided together. Correct? But on the other hand, amoxicillin, clavulanic acid, tazobactam, piperacillin, sulbactam, and your ampicillin, DOTS therapy, pyrazinamide, rifampicin, isoniazid, and ethambutol are given together. Booster therapy, NRTIs plus protease inhibitors. So many you cannot give ketoconazole and amphotericin B together, but you can give amphotericin B plus 5-flucytosine together, right? So there are so many combinations which can be given and which cannot be given. Some like hypericin with SSRI cannot be given, though both are antidepressants, but they will significantly affect your serotonin and norepinephrine levels, right? So there are certain combinations, certain interactions that should be avoided. So that must be at the tip of your tongue. All right. So identifying the adverse effects as well, like cardiomyopathy, rhabdomyolysis, nephropathy, neuropathy, retinopathy, ototoxic, neurotoxic, right? So many adverse effects: gray baby, floppy baby, red man, blue baby, purple toe, floppy iris, Steven Johnson, connectorus, crystalluria, red orange discoloration of urine, SLE. So many adverse effects you have. I will anaphylactic reaction, Jarvis-Herxheimer reaction. So identifying the important adverse effect, then like cheese reaction. So you should know cheese reaction is nothing but hypertensive crisis. There's an increase in the excessive blood pressure level causing the hypertensive crisis. All right. So that must be at the tip of your tongue. That must be at the tip of your tongue. Yes, are you all clear till here? Any queries, any doubts, anything that you wish to ask? Some like NSAIDs cause GI bleeding. So you should know that after having, that is why many times, you know, for painkiller action, we also give ceratopeptidase with diclofenac or Zerodol SP. You would have heard Zerodol SP, maybe we give ceratopeptidase along with some the other analgesic. So probiotics. So in IBS or in the gut microbiota condition, you also give, especially diarrhea, you give bifidobactam lactobacillus supplements. So concomitant medications which are given along with it to prevent any adverse effects. Cilastatin, imipenem. There are so many examples yet. Well, I will just go on and the examples won't end. Correct? So monitoring plan. It is very important that you continuously monitor your plan. You know the doses, you know the dosage form, you know the regime, you know the pediatric case, geriatric case, special population, if there's any other case involved. Similarly, over here, there's one question that I've bought for you. See, there are 4 types of receptors: ligand gated, GPCR, enzyme linked, nuclear. So, I have to name the 4 types with the examples. So, you should be, you know, train yourselves in such a, matlab, is tarike ke question solve karo. So, you will come to know that your ability, clinical ability will also increase and your case based scenarios will also increase along with the theoretical knowledge. Next up, you have antiplatelet drugs, ADP receptor antagonist, clopidogrel. Next up, you have thromboxane synthesis inhibitor, aspirin. Then you have phosphodiesterase inhibitor, dipyridamole, GP2B3A inhibitor, abciximab. Right? So there are so many agents that act as an antiplatelet. So such kind of mechanistic questions, important question. Now this, ringer lactate. We all know in diabetic patient you cannot give D5W, dextrose 5% as a isotonic agent. You can give RL, right, for maintaining isotonicity, compound sodium lactate injection. But if a person is having hypoglycemia, and then in such patients you will give D5W, dextrose 5%, to counteract that hypoglycemia. So these are some of the most important points. And solving MCQs. The more you practice, the better you become. So you should be absolutely aware. Thank you so much. This is Payam sir, solving OSCEs for you, solving your case-based clinical questions. We'll be coming up with more such informative videos. Comment करके जरूर बताना अगर आपको ये video अच्छा लगा. If you like the video, do comment. And that's it. Payam sir signing off. Thank you so much. Stay connected. Stay tuned with us.